92% of American adults are deficient in a mineral that directly controls whether calcium builds up in your joints or stays in your bones where it belongs. Not 92% of elderly people, not 92% of people with diagnosed conditions, 92% of all adults. And your doctor will never test you for it. Not because the test is expensive, not because it is complicated, because the standard blood test they would order shows almost nothing about whether you actually have enough of this mineral in your body. The test measures what is floating in your bloodstream at that exact moment, which represents roughly 1 to 2% of your total body stores. The other 98% sits in your bones, your muscles, your organs, completely invisible to the lab work your doctor orders every year at your annual physical. I am Nathan Cross. I practiced internal medicine in Chicago and Boston for 12 years before I realized I was spending more time fighting with insurance companies than actually helping patients understand their bodies. That system was not designed to keep you healthy. It was designed to treat you after you get sick. There is a difference, and that difference is why I started this channel. Subscribe to Dr. Cross and hit the notification bell. We are building this channel one honest conversation at a time, working toward 1,000 subscribers. Every single one matters because it means one more person gets information they will not hear in a waiting room. The mineral I am talking about is magnesium, and if your knees crack when you stand up, if your fingers feel stiff in the morning, if your shoulders ache after a full day, if you wake up with your hands clenched and your jaw tight, there is a very good chance your body is screaming for magnesium, and nobody has been listening. Not your primary care doctor, not the orthopedist who told you to ice it and take ibuprofen, not the physical therapist who gave you a resistance band and wished you luck. Here is what the waiting room visit will not tell you. Magnesium does not just sit around in your body doing one job. It is involved in more than 300 different enzymatic reactions. It regulates how your muscles contract and relax. It controls how your nerves send signals. It determines whether calcium goes where it should go or where it absolutely should not go. And when you do not have enough magnesium, calcium stops behaving. It leaves your bones where you need it for strength and starts depositing in your soft tissues, your joints, your arteries, your kidneys, places where calcium crystals do not belong, but where they cause extraordinary damage once they settle in. Most people believe joint pain is just part of getting older. You turn 45 and your knees start complaining. You hit 50 and your hands do not grip like they used to. You reach 60 and you start talking about the weather because you can feel it in your joints now. And the healthcare system validates this belief every single day. Orthopedists shrug and mention arthritis as if it is an inevitable consequence of time. They talk about wear and tear. They recommend glucosamine and chondroitin. They eventually start discussing surgery. What they do not discuss is why your cartilage is breaking down in the first place. What they do not test is whether you have the fundamental building blocks your body needs to maintain healthy joint tissue. And this is where most people have been getting it wrong for years. Joint degeneration is not a calendar problem. It is a chemistry problem. Your cartilage is living tissue. It does not just sit there like a piece of rubber absorbing shock. It is constantly being broken down and rebuilt. Specialized cells called chondrocytes live inside your cartilage, and their entire job is to maintain and repair the matrix of proteins and sugars that give cartilage its structure. But those chondrocytes need raw materials. They need building blocks, and one of the most critical elements they need is magnesium. Magnesium activates the enzymes responsible for synthesizing glycosaminoglycans, which are the long sugar molecules that attract water and give cartilage its cushioning properties. Without adequate magnesium, your chondrocytes cannot produce these molecules efficiently. Your cartilage loses its water content. It becomes brittle. It starts to crack under pressure that it used to handle easily. But the damage goes deeper than just construction problems. Magnesium also controls inflammation at the cellular level. It regulates something called nuclear factor kappa B, which is the master switch for inflammatory responses throughout your body. When magnesium levels drop, that switch gets stuck in the on position. Your joints become chronically inflamed, even when there is no acute injury. And chronic inflammation accelerates cartilage breakdown faster than anything else. Now, here is the part that makes this truly insidious. As your magnesium stores deplete, your body starts pulling calcium out of your bones to maintain blood calcium levels, because blood calcium has to stay within a very narrow range or your heart stops beating. Your body will sacrifice your bone density to keep your heart functioning. It has no choice. But when calcium floods out of your bones and magnesium is not there to direct traffic, that calcium does not just disappear. It deposits wherever it finds a landing spot. And inflamed joint tissue is an incredibly attractive landing spot for calcium crystals. Those crystals form sharp deposits on the edges of your bones. They accumulate in the synovial fluid that is supposed to lubricate your joints. They trigger even more inflammation as your immune system tries to clear them out. The result is a vicious cycle. Low magnesium leads to inflammation. Inflammation attracts calcium deposits. Calcium deposits cause more inflammation, and your joints slowly transform from smooth functioning hinges into grinding, painful joints filled with crystallized debris. The cracking sound you hear when you move is often the sound of those calcium crystals scraping against each other and against your joint surfaces. Not always. Sometimes it is just nitrogen bubbles in your synovial fluid, which is harmless. But persistent cracking that comes with stiffness or pain is often a warning sign that mineralization is happening where it should not. I want you to try something right now. Make a tight fist with both hands. Hold it for 5 seconds. Now release and spread your fingers as wide as they will go. Do it again. Make a fist. Spread your fingers. How does it feel? If your knuckles crack every single time you close your hand, if your fingers feel stiff when you first wake up in the morning, if you notice that your grip strength has decreased over the past few years, those are signs that the tissues in your hands are not getting what they need. How old are you? Drop your number in the comments. I ask because after 50, magnesium absorption in your gut decreases significantly. Your kidneys also become less efficient at conserving magnesium, so you lose more in your urine. This means that even if you are eating the same diet you ate at 35, you are probably absorbing and retaining far less magnesium. The combination of decreased absorption and increased loss creates a deficit that compounds year after year. But here is the part that changes everything. Most doctors never see this coming because they trust the blood test. A patient comes in complaining of joint pain. The doctor orders a comprehensive metabolic panel. The magnesium level comes back at 1.9 milligrams per deciliter. Normal range is 1.7 to 2.2. The doctor sees normal and moves on. The patient gets told their joint pain is arthritis, age-related degeneration. Maybe they need to lose some weight. Maybe they should try physical therapy. What that doctor does not know or does not remember from biochemistry class is that your body will maintain normal serum magnesium levels until you are so depleted that you are on the verge of serious cardiac or neurological problems. Your blood magnesium is the last thing to drop. By the time it shows up as low on a standard blood test, you have been functionally deficient for months or years. There is a better test called red blood cell magnesium, or intracellular magnesium. It measures the magnesium inside your cells, which is a much more accurate reflection of your total body stores. But most primary care doctors do not order it because insurance companies do not like paying for it when the regular magnesium test is cheaper. And even when they do order it, the reference ranges are often wrong because they are based on population averages, and the population average is deficient. I stopped accepting that answer years ago, and you should too. Let me tell you about Richard. Richard was 58 when he first walked into my office in Vermont. He had been a carpenter for 35 years. His hands were thick and strong, covered in the scars and calluses of someone who had spent a lifetime working with wood and tools. But over the previous 3 years, those hands had started betraying him. His fingers were stiff every morning. He had to soak them in warm water for 20 minutes before he could grip a hammer properly. His knees creaked when he climbed ladders. His shoulders ached at the end of every workday. He had seen an orthopedist in Burlington who took x-rays of his knees and hands. moderate osteoarthritis in both knees, early arthritic changes in several finger joints. The orthopedist told Richard what orthopedists often tell carpenter who have worked with their hands for decades. This is wear and tear. This is what happens. We can manage the pain with anti-inflammatories, and when it gets bad enough, we can talk about joint replacement. Richard was not ready to accept that answer. He loved his work. He was not ready to retire. He was not ready to start thinking about knee surgery. So he asked me if there was anything else he could do. I ordered an intracellular magnesium test. It came back at 42 milligrams per deciliter. The lab reference range said normal was 35 to 60, but I had read enough research to know that optimal levels are above 50, and anything below 45 correlates with increased inflammation and tissue breakdown. Richard was deficient by functional standards, even though he was technically normal by lab standards. I put him on a protocol. We made specific dietary changes. We added a particular form of magnesium supplementation, and I told him to give it 90 days before deciding whether it was working. He came back 4 months later. His morning stiffness had decreased by about 70%. He could make a fist without pain. His knees still cracked occasionally, but the ache that used to linger all day was gone. He was sleeping better, his energy was better, and he had stopped taking ibuprofen every single day, which his stomach was grateful for. That was 3 years ago. Richard still works as a carpenter. He still has some arthritis on his x-rays because cartilage damage that has already occurred does not magically reverse. But the progression stopped. His symptoms improved dramatically, and he avoided surgery that would have ended his career. Now, I need to pause here because this next point is critical. Before we go further, there are signs that should take you straight to a doctor, not to a YouTube video. If you have joint pain that came on suddenly and is accompanied by fever, that could be septic arthritis, which is a medical emergency. If you have severe pain in one joint that is red, hot, and swollen, that could be gout or pseudogout, both of which need immediate treatment. If you have joint pain along with a rash, that could indicate an autoimmune condition or Lyme disease. If your joint pain is so severe that you cannot bear weight or move the joint at all, you need imaging and evaluation. Magnesium is not a substitute for proper medical assessment when something serious is happening. But for the vast majority of people experiencing gradual onset joint stiffness, morning aches, cracking sounds, and decreased flexibility, the underlying issue is often nutritional and completely reversible if you catch it early enough. This brings us to the practical question. What do you actually do about it? First, you need to understand that magnesium supplementation is not as simple as walking into a pharmacy and grabbing the first bottle you see. There are at least 8 different forms of magnesium supplements, and most of them are terrible. Magnesium oxide is the cheapest and most common form. It is also the least absorbable. Your gut absorbs maybe 4 to 5% of magnesium oxide. The rest sits in your intestines pulling water in, which is why magnesium oxide is sold as a laxative. If your joints hurt and you start taking magnesium oxide, you will spend a lot of time in the bathroom, but your joints will not improve because the magnesium is not getting into your cells. Magnesium citrate is better. Absorption is around 30 to 35%. It still has a laxative effect for many people, but at least some of it gets absorbed. The forms that actually work for tissue repair are magnesium glycinate, magnesium malate, and magnesium threonate. Magnesium glycinate is magnesium bound to the amino acid glycine, which helps transport it across your gut lining and into your bloodstream. Absorption is around 40 to 50%, and it has the least laxative effect. Magnesium malate is magnesium bound to malic acid, which is particularly helpful if you have muscle pain along with your joint pain, because malic acid supports energy production in muscle cells. Magnesium threonate is the newest form, and it crosses the blood-brain barrier effectively, so it is excellent if you also have issues with sleep, anxiety, or cognitive function along with your joint problems. For joint health specifically, I typically recommend starting with magnesium glycinate. The dosage matters. Most people need between 300 and 500 milligrams of elemental magnesium per day from supplements, taken in divided doses. Elemental magnesium means the actual magnesium content, not the total weight of the pill. A 400 milligram capsule of magnesium glycinate might only contain 80 milligrams of elemental magnesium, because the rest is the glycine. You have to read the label carefully. Start with 200 milligrams of elemental magnesium once per day with food. Take it at dinner or before bed, because magnesium also promotes muscle relaxation and can help with sleep quality. After 1 week, if you are not experiencing any digestive issues, increase to 200 milligrams twice per day, once with lunch and once with dinner. After another week, you can increase to 300 milligrams twice per day if needed. How do you know if you need the higher dose? Pay attention to your symptoms. If your morning stiffness is improving but not gone, if your joints still crack frequently, if you are still experiencing muscle cramps at night, you probably need more. If you start experiencing loose stools, you have exceeded what your gut can absorb and you need to back down. But supplements are only half of the equation. Food sources of magnesium are critical because they come packaged with other nutrients that work synergistically. Pumpkin seeds are one of the richest sources. 1/4 cup of raw pumpkin seeds contains about 190 milligrams of magnesium. They also provide zinc, which is important for cartilage synthesis and healthy fats that reduce inflammation. I tell my patients to keep a container of raw pumpkin seeds on their counter and eat a small handful every afternoon as a snack. Dark chocolate is another excellent source, but it has to be real dark chocolate, at least 70% cacao. 1 ounce of 70% dark chocolate provides about 65 milligrams of magnesium, along with powerful antioxidants called flavonoids that reduce oxidative stress in joint tissue. If you are going to eat chocolate anyway, make it count. Certain fish are surprisingly high in magnesium. Mackerel and halibut both provide around 90 milligrams per 3-ounce serving. They also deliver omega-3 fatty acids, which are potent anti-inflammatories. Wild-caught salmon is slightly lower in magnesium at about 30 milligrams per serving, but the omega-3 content is higher, so it is still an excellent choice. Leafy greens are the classic recommendation, and they are valid. Spinach provides about 80 milligrams per half cup cooked. Swiss chard is similar, but here is what most nutritionists do not tell you. The bioavailability of magnesium from leafy greens is limited by oxalates, which are compounds that bind to magnesium and prevent absorption. This does not mean you should avoid leafy greens. It means you should not rely on them as your only source. Black beans are underrated. 1 cup of cooked black beans delivers about 120 milligrams of magnesium, along with fiber and resistant starch that feed beneficial gut bacteria. And healthy gut bacteria actually produce compounds that improve magnesium absorption, so there is a synergistic effect. Here is a practical implementation plan. Week 1. Add magnesium-rich foods daily. Start mornings with dark chocolate and almonds, about 75 milligrams combined. Lunch gets black beans or spinach with pumpkin seeds for another 100 milligrams. Dinner includes fish twice weekly or plant sources like quinoa. By week 1, you are getting 200 to 250 milligrams from food. Week 2. Start magnesium glycinate at 200 milligrams daily with dinner. Continue the foods. Total intake, 400 to 450 milligrams daily. Week 3. Increase supplement to 200 milligrams twice daily. Total intake reaches 600 to 650 milligrams, the therapeutic range. What to expect? Weeks 1 to 2 bring better sleep as magnesium promotes GABA production. Weeks 2 to 4 show reduced muscle cramping. Joint improvements take longer. Morning stiffness decreases around weeks 4 to 6. Cracking becomes less frequent and painful. Range of motion improves by weeks 8 to 10. By week 12, noticeable improvement in joint comfort and function allows reducing to maintenance doses of 200 to 300 milligrams daily. Factors that sabotage this protocol: Calcium supplements compete with magnesium for absorption and drive soft tissue calcification. Most people get enough calcium from food. Proton pump inhibitors like omeprazole block magnesium absorption. Alcohol increases urinary magnesium loss and gut damage. High sugar intake spikes insulin, which dumps magnesium through kidneys. Stress releases cortisol and adrenaline, both increasing kidney excretion. If you are over 50 and chronically stressed, you are almost certainly deficient. Magnesium works synergistically with other nutrients. It activates vitamin D for calcium absorption and bone health. It regulates parathyroid hormone. Without it, parathyroid glands go overactive, pulling calcium from bones unnecessarily. Magnesium and potassium work together for electrolyte balance. Low magnesium means you cannot retain potassium, causing weakness and cramping. Vitamin B6 transports magnesium into cells. Adding a B complex can significantly improve results. This is why whole foods matter. Pumpkin seeds give you magnesium plus zinc, B vitamins, and healthy fats working synergistically. Let me give you a sample day. Wake up and do the FIST test as your baseline. Breakfast: smoothie with banana, spinach, almond butter, protein powder, and melted dark chocolate for 60 milligrams. Mid-morning: 1 ounce of pumpkin seeds for 100 milligrams. Lunch: salad with black beans, avocado, olive oil for 120 milligrams. Afternoon: 10 almonds. Dinner: grilled mackerel with vegetables and quinoa for 150 milligrams plus omega-3s. Evening: 200 milligrams magnesium glycinate. Total: 550 to 600 milligrams daily. Repeat for 90 days. You sleep better, cramp less, move easier. At 90 days, the FIST test shows knuckles that do not crack constantly, fingers that feel flexible mornings, knees that move smoothly. You have not needed ibuprofen in weeks. You might be wondering how this connects to what I said earlier about the healthcare system. Here is the link. The system is not structured to identify or address nutritional deficiencies before they cause disease. Insurance companies reimburse doctors for treating diagnosed conditions, not for preventing them. There is no billing code for teaching someone how to eat pumpkin seeds to preserve their cartilage. There is a billing code for cortisone injections. There is a billing code for arthroscopic surgery. There is a billing code for total knee replacement. The financial incentives are completely backwards, and until that changes, you have to be your own advocate. You have to ask questions your doctor might not have answers to. You have to do research. You have to experiment carefully with dietary changes and supplementation. You have to pay attention to your body instead of just accepting that pain is normal. I spent 12 years inside a system that was never designed to give you this conversation. That is why this channel exists. I left that system because I could not keep looking patients in the eye and telling them there was nothing else to try when I knew there was. Richard, the carpenter I told you about earlier, sent me a message last month. He is 61 now. He is still working. He is still pain-free most days. He told me he has referred 4 of his friends to the magnesium protocol. 3 of them have had significant improvement. The 4th did not stick with it long enough to see results. That is the reality. This is not a magic pill. It requires consistency. It requires 90 days minimum before you can fairly evaluate whether it is working. It requires dietary changes that some people are not willing to make. It requires spending money on quality supplements instead of cheap garbage. But for the people who commit to it, the results are often profound. The cracking knuckle test I mentioned earlier is something you can do right now. Make a fist. Spread your fingers. Do it 5 times in a row. If your knuckles crack every single time and you feel stiffness or discomfort, that is a sign. It is not diagnostic. It is not proof of magnesium deficiency, but it is a signal that something is not optimal in those joints. Track that test over the next 90 days as you implement this protocol. Write down how many times out of 5 your knuckles crack today. Do the same test once per week. Watch the number decrease. That is your feedback loop. That is how you know it is working. And this is where most people make their biggest mistake. They feel better at week 6, and they stop. They assume the problem is solved. but you were deficient for years. 6 weeks of repletion is not enough to fully restore your tissue stores and repair the damage. You need 90 days minimum for significant tissue repair, and after that, you need maintenance. You do not go back to eating a magnesium-depleted diet and expect to maintain your results. I am Nathan Cross. I spent 12 years inside a system that was never designed to give you this conversation. That is why this channel exists. Subscribe, leave a comment, and share this with someone who needs to hear it. The only way this information reaches the people who need it most is if you help it get there. Tell me in the comments, how old are you? And when you do the fist test right now, do your knuckles crack? I read every single comment, and your feedback helps me understand what content to create next. We are building toward 1,000 subscribers. Every single one matters because it represents one more person who gets real answers instead of a prescription and a shrug. Thank you for watching. Take care of those joints. They are the only ones you get.